I am joined by another one of our amazing speakers from this year's conference. It's Jacob Haddad, CEO and co-founder of Accurx. Jacob is co-founder and CEO of Accurx, a communication platform used in 73% of NHS trusts and by 98% of GP practices. Accurx is on a mission to join up communication across healthcare to make patients healthier, staff happier, and the system more efficient. Jacob, welcome to the studio.
Thanks for having me.
Sounds interesting. Tell us a little bit more about you, about Accurx. Introduce yourself to the world.
Absolutely. So we see healthcare as a communication industry. And what I mean by that is if you go and speak to staff on the front line and say, what did you do today? They'll say, I had to make a referral, I had to coordinate a patient's care, I had to coordinate their discharge. They had to communicate. That's where the value's added. But it's also really hard to do. It's reliant on pagers and phone and emails and phone tennis and calling a switchboard and waiting for letters to arrive. And when it doesn't go well, that's when things often go wrong. So that's the problem we're focused on solving. We started in GP practices, so most people will have used us. They may not have realized it, but when they get messages from their GP practice or they get in touch with their GP practice, that will likely be through us. But a lot of our growth now is in other parts of the health system. So make it easier for hospitals to communicate with their patients, for community providers, mental health providers. And what's particularly exciting is the places really grasping it are actually changing how they deliver care. So instead of just doing everything in appointments and then sending messages, they're actually coming up with much more innovative and modern ways to meet their patients' needs.
And how's the sort of system developed, if you like, from initial implementation? Has there been many changes, updates, or how sort of recent is it that it's all been implemented?
Yeah, lots and lots of, we release updates multiple times a week.
Oh wow, that much.
That regularly, yeah. So we started, actually as a company, we started in antibiotic prescribing. This is 8 years ago now. And realised that that wasn't as big priority for lots of people, but there were all these other unsolved problems. And so we went and spent about 6 months essentially living in a GP practice every day, on the phone, shadowing appointments, doing experiments to improve patient flows and improve quality, improve efficiency. And that's where we realised that communication was this huge challenge, but also this huge opportunity. And then since then, we've just added functionality. So we started off with quite basic, you can send a message to a patient, but now we let clinicians collect structured data from patients, we let patients get in touch with their service through us, we let clinicians invite patients to book an appointment of a specific type, so a whole range of much more advanced functionality. A lot of our growth now is also communication, not just with patients, but between different people within the health system. So for example, between GP and, let's say, cardiology, if you're getting some advice, or between a GP and a patient's district nurse. That's where we're seeing a lot of opportunity and a lot of growth as well.
And what was the inspiration initially in terms of, was it you trying to improve the patient experience? Was it to make GPs' lives easier, or a collaboration of everything together?
Yeah. It's all of those, and I think those things aren't mutually exclusive. So in general, if you can make a clinician's life easier, you're probably going to make the patient's experience and outcomes better, because these are time-pressed staff. They have a lot of important things to do with patients if they're able to have the time. We actually started, I would say, very, very focused on the patient, and we still are. But what quite quickly emerged was how much impact we were having for staff, who was spending a lot of their time trying to chase things up or get hold of people, and that's one of the things we're most proud of, is how the time we save them. The more subtle human things of people say, oh, it's great, I can get home on time and see my kids, so they're not spending an hour at the end of the day chasing things up. So yeah, the impact's right across the system. The one that we probably don't talk about enough are the productivity benefits for the system. So if you look at general practice over the last 5 years, the workforce of GPs has gone down slightly, but the activity they're doing is far higher. And hospitals at the moment is the opposite trend: much bigger workforce, but lower activity on the whole. And the big driver for that is, in general practice, so much of what would have been an appointment 5 years ago is now delivered through messaging, which can be much, much more efficient and much more productive. And that's what, when we see all these challenges in the news around waiting lists, around funding, around staff shortages, the root cause of all of those is, until we find ways to deliver productivity gains, it's going to be very, very hard to fix those challenges, and that's where we see communication as the biggest opportunity.
Okay, and is there any, we focus a lot of innovation, new technologies and developments, any AI in it, or is it all sort of software-based, process-based? Have you adapted to AI, or?
There are things we are working on at the moment, but in the live product, we haven't yet integrated AI features. I would say a lot of what we're doing is getting the basics in place.
Yes.
So the basics of, you can contact your practice and they can collaborate and assign that request. Let's say you've got a new medical problem to the right place. Getting the basics working really well, and then we can layer that sort of intelligence on top. So that'll be coming, I think, is an inevitability in healthcare, but we've got to be really careful that we apply it where it's really needed, rather than there's a temptation to apply AI to anything and everything, and risk that it can be a gimmick, or can be a distraction. So we're very focused on getting the basics in place.
Super. And as I did mention before, you're one of our speakers today. You've got a session coming up later on, which is transforming the outpatient's operating model using digital communication. If our audience were to tune in or join that session, what kind of things are they going to be, the sort of key points, areas that you're going to be covering in that?
So what we'll be talking about and looking at is the way outpatients care is delivered hasn't changed in about 50 plus years. It's still very much, you come in for an appointment in a building, maybe now some of them are over the phone. At the end you're told, right, follow up, we'll see you in 6 months, all of these tests. And that model just hasn't changed. And particularly when there's such long waiting lists, the vast majority of them are for outpatients rather than, say, for surgery. We need to redesign that model. So what we'll be talking about is, if you had a clean slate, we were redesigning outpatients today, how would you do it? What would it look like? How we make sure we're using our capacity for the patients who need it most? How we make sure we're doing more asynchronously, so more through messaging, like I was talking about in the general practice example. And those are some of the things we'll be talking about. We've got a clinician with us as well, so they'll be giving that perspective of how they're changing how they interact with their patients as well.
Okay, and what does sort of the outcomes you'd like people to sort of take away, potentially adapt and adopt to, within their own organisations following that session?
So the main outcomes we want people to take away are how to start making these changes soon to your services. So the things we've seen have the biggest impact. We've developed this new model, clean clinic model, where you make sure that every appointment in your clinic really is an appointment worth having. And so the things we're looking at are your follow-ups. Are all your follow-ups for patients who really need them, focusing them on patients who really need them, preparing patients, making sure the patients who see you have had all the right diagnostics, they've collected all the right data before, and then converting things that would have been an appointment to messaging wherever you can. So those are the three takeaways we really want to get across, that people can go back and start thinking about how they adapt their services.
Okay, and in terms of the show itself, how's been your experience so far? Because I know you've got an exhibition stand here, haven't you, in the hall?
Yep.
How have you found sort of day one yesterday and this morning as well at the show?
Yeah, so we've got a stand here. It's been great to meet people from across the system, both from providers, but also other suppliers we're familiar with. Hear more about some of the trends that are going on, and it's really good for the team as well to be out there, for us to be talking to a lot of some of our users, some of our customers coming up, but also seeing the wider trends in the system.
And so have you had any highlights or discovered any trends that you are going to take away from the show? Any key take-home moments?
One of my highlights, so it's sister-in-law's a surgeon. I had a lot of fun playing on the robotic surgery robot. So I'm going to go back and say, no, I've had a taste of what you do today. But no, more broadly, it's some of the highlights have been talking, seeing how other companies are addressing these sorts of challenges. I'd say it's the first year where we're seeing how some of the other tech companies are starting to think about AI in their products. So it's been interesting to see that.
And in terms of your own journey, where you've come from, just tell us a little bit about you. How did you actually get into the sort of healthcare space initially, and what was your sort of inspiration to do so?
So I came from an engineering background and was then lucky to spend my last bit of university doing quality improvement in healthcare, which I absolutely loved. And then went into the consulting world, actually with one of the firms here today. Focused on healthcare, but then moved on to start Accurx to really, I think it's very hard to do things at scale unless you're using software, unless you're using digital to have a scaled impact. And so that's what led me to start Accurx about 8 years ago, using technology to try and drive a lot of this change.
And do you think the future is like massive technological injection? Do you think that is really going to sort of streamline the healthcare system as a whole?
Yes and no. So does tech have a place? Absolutely. And if you look at the last 100 years of medicine, it's been completely full of technology innovation, often very on the clinical and on the medical side. The drugs we have, the diagnostics we have, the treatments we have available. I would say we're in a point now where the tech is not the barrier. The barrier is the change management, the implementation. Like a lot of what our product does is actually simpler. Now, simple doesn't necessarily mean easy, but the really, really hard bit is actually changing how care is delivered, not necessarily coming up with the tech. So I do think, yes, the health system technology is absolutely pivotal to it becoming more productive, more efficient, delivering better outcomes. But actually, the really hard bit is going to be how we apply that technology very well to real problems, not just here's a shiny thing, let's put it in.
Absolutely.
And that's what we spend a lot of our time working on, is making sure that people are getting the most out of our software and how they deliver care.
Brilliant. Well, I'd say 98% of GP practices are using it, so I'd say hopefully most people are going to be familiar with it. So, Jacob, it's been insightful. Thank you very much for coming in and speaking to us today.
Thanks for having me, Simon.
That was Jacob Haddad there from Accurx.